Asia, when the wave was so strong about the COVID and the spread out, that is not about, even if we are talking about our loved ones and things like that, is the health system. The health system is overstretched, and if the healthcare workers are now being infected, who will now take care of
We
other
are not even
individuals?
being tested. Do you understand? Even because I had symptoms, I will still be made to work. They're trying not to test health workers.
Okay.
They're trying to make sure that you don't get tested. And even if you get tested and you are positive and there is no symptoms, you go back to the workforce.
I think that is another topic, another thing we are going to talk about, because this is quite unfair on the part of the health institutions, managers, with the way they were treating the healthcare professional during the course of this COVID-19. We're still going to discuss about that, because that is something we have to elaborate more. It is quite unfair on the part,
It's
because
unfortunate.
even we had a lot of a lot of healthcare workers that died. In fact, I think I read an article. It happens in India. There were some doctors, there were some healthcare professionals that died. Government promised to give some kind of, at least to compensate the family. And people were queuing. They were on the queue. Even some of them were saying that they went to the government office to get this compensation. Nothing is coming for them.
They're human, they'll tell you.
Yeah, yeah. So we are still going to. So, Alhamdulillah, we have to thank God that you are back to your feet. Thank
Alhamdulillah.
thank God for that.
We went, we saw, we conquered.
Okay, yeah, exactly. Now, this will take me to the question on vaccine. Now, why are there so much controversies on this vaccine? Why? What is the problem? Knowing fully well that even the scientists and laboratory scientists and professionals have said it on different fora that to develop a vaccine it takes a longer time. But even at that, this affected the whole world. So personally, I'm talking on a personal thing now, that I feel like if the whole world join hands together, it is something that we can fast track it. It is possible.
That is
Nothing
one
is
thing,
impossible.
exactly,
Yeah,
because
yeah.
that is one thing I want people to understand.
Yeah.
I get it, it was fast, right? Yes. But before the FDA can say they are issuing an emergency use authorization for a particular drug, they have definitely weighed the benefits over the risks. People were dying. Are they working? Are they still working on this thing? Yes. You know, can they promise you that when you take it, you won't get coronavirus? No. But the fact that there is light at the end of the tunnel, it is not limited to one country. That is what I want people to understand. It is a global pandemic. And I'm going to use a typical example so that people will understand. It's just like we are five people in a house and we have to wash plates, do the laundry, cook, and take care of the children. If you leave that task alone to one person, he or she might not finish in a whole day. But if we choose to come together and divide these tasks, it makes it easy. When COVID started, scientists stood up and researchers, what can we do? Because it is a viral infection, we have other benchmark for other viral infections that they have been working on that was shelved. So it's not like they don't have a baseline for this thing. But we can only try to explain to people. We can't convince them. But I just want them to know that a scientist in China, okay, we will work on the replication of this thing. You work on the benefit on this thing. Why does country work on, and they are communicating their findings to each other. There is no way it will not be fast. Would there be side effects? Yes. Even the regular vaccines we take that were sure they took years before it came out. Are there side effects? Yes. And like mothers will understand this better. When your child takes penta vaccine at 6 months, at 6 weeks, the fever and pain they come down with is not the same as when they take the second dose at week 10. And that is normal. It is this is like a process. You're introducing something into my body. Even if I cut myself with a knife, I'm not going to feel the same pain I will feel on that particular day, the second day. So yes, nobody is going to promise you that if you take this vaccine, nothing is going to happen to you. But people coming in with the fact that, oh, it's 666, they are trying to make us take it. No, see, there's this thing. It is not mandatory. Do you want to take it? No, I don't want to take it. Nobody is going to force you. Like the flu vaccine that we take every year, there are different strains. So it's possible that you will take this corona vaccine now, this COVID vaccine. So it's not, we are only saying it could help us with the spread and help us with this current pandemic that we have right now. We are not saying it's taking it away. It might as well be a yearly thing.
Okay.
We can't rule that out. So
Thank you for that. Thank you. I see my viewers. You can see she's fully prepared. At least we can testify. She's well informed. She knows about it, and that is why she's giving it out to us. Thank you for that beautiful information. Now, I want to go back to this issue of vaccine and Africa. Now, considering the figures that we had that is flying around, we know that United States of America has the highest number of contamination, I mean, mortality and mobility rates, followed by the Europe. Then we now have the Asia continent. Luckily for Africa, the mortality and mobility rate was so low compared to other continents. Now, how beneficial is this virus to Africans? I am asking this particular question because I know some African countries already they are waging all their efforts to ensure that they have this vaccine. Is that the priority for Africans, or how beneficial is it to them?
well, see, the basic truth is these things started from China. I think we are forgetting the fact that this world is very, we are forgetting that we need each other. We are forgetting that we need to look out for each other. How did it leave China to every part of the globe? We travel for pleasure. We travel for business. We go for medical tourism. As long as this contagion is in a particular place, it will continue to spread. China was successful at the point to defeat it, right? They said, oh, now it's off our continent. Can they say the same now?
No, it's
Did it
back
not go
again.
back? Did it not go back? Why are the same country getting infected? Why did it get to Antarctica that did not even have cases for a long time? It's because we are so small. We keep moving around. We have to have each other's back. So because of the fact that we feel like the mortality or morbidity or the infection rate is little. So we feel we don't need it. It's not a priority right now. The same people that we feel, oh, they have it in their country or they are dealing with it, they will either bring it to us or we'll carry our two legs to go into that place and bring it back home. So why not just deal with it right once and for all? Why not just get immunized? So that you know that even if I go in there, the possibility that I might have the chances is reduced. You know, my body is immune. Like I told you, viral infection, they are dependent on the immunity of the host. So why not just protect yourself? Why not just fight for us? It's not
Thank you.
about right now. I don't think it's about the number. I think it's about fighting this thing together.
This thing together. Thank you very much for
Yeah.
that beautiful answer. And now I believe some of the policymakers, regulatory bodies that are watching right now, individuals that are watching can see that the vaccine, it is very important for all of us, for every part of the world should have
It
access
is.
to this vaccine because
Yeah.
the disease itself is pandemic. Thank you very
The
much for that
the
beautiful
world is
answer.
small.
Yeah. Now that will take me to this question now. Now, as healthcare practitioners, what should the healthcare managers, healthcare institution managers do to protect healthcare practitioners? Because We've been talking about all this all around. The only thing that we see, especially in developed world, in Europe, in the United States of America, in Asia, is that at a point in time, I'm talking about the first lockdown globally, we see that people will come out and clap and sing and do all these things. Fine, is a kind of motivation. These are the heroes. It is lovely. We appreciate the society doing that. But people at the realm of affairs in the healthcare institutions, what were they doing in protecting healthcare professionals? For instance, before COVID-19 left China to other parts of the world, we were supposed to have public health officers. We have epidemiologists. We follow things. Thank God for social media. Whatever happens in China today, we can see it wherever we are in our part, in any part of the world. So was there any laxity from the healthcare managers, from healthcare institutions? Because I know vividly in some parts of the country, even in United States of America and even in UK, there were issues about we don't have enough masks, we don't have enough PPE, we don't have this, we don't have that. And yet, we have seen it that there is a problem in Asia, there's a new virus in Asia, knowing fully well that Chinese are in every part of the world. Why are what should the managers, healthcare managers, do to protect the healthcare professionals?
I must be sincere with you. I am in the field. I get it. I I want to say it categorically that we were so confident it will never get to us. The lack of preparedness and the carelessness of our people is what has led us to where we are right now. I know that when there is a global thing, because when it was in China, they felt that if they lock down, it won't get to us. But at what point did we lock down? What happened to those LD carriers that brought it in? What happened to those people that they'll tell, okay, fine, they were testing negative and they won't test possible until the end of their quarantine and they're already in your country? We were not prepared. Let me just say that it was our lack of unpreparedness that led us to where we are right now. People were like, no, it can't get to us, it can't happen. And when your house is not stocked, it's just like a storm is coming, and they tell you a storm is coming, a storm is coming, and you believe, no, it can't affect me. I don't have to go to the store. What I have is enough.
It's enough.
And unfortunately, most people depend on China for production of all of these things. Now China is affected. Now they have to hoard what they have. They have to protect their own people too. And eventually, when it was time for China to say, okay, we are ready to let go, I think we have enough, trust issue came in. They're like, these things cannot be transmitted. I know viruses are small, but they cannot survive that much on the outside surface. So like, okay, China is trying to ship in COVID-19 to us. We are going to try to start producing our own. The distance or the process that it took for us to say we can stand on our own, it already hit us. Care workers are already saying they're exhausted. They can't do this again. People are willingly even saying they are not working, even when they are being offered incentives. Where are the protective things to use? I must tell you categorically that since I've been treating COVID-19 patients in the United States, all I've been offered for protection is N95 and the regular surgical, regular gown. There was nothing like you kit up like you are going into the moon. And they have the same things in Africa. They have all these things in China. They have all these things in other countries. You see, that protecting us means giving us things to go to war with, right? Are we ready to do this thing? Yes. Are you giving us things to fight with? No. People that say they are not working is because of the fear of getting this infection. It's because they are nothing to use. And they are saying, if the down is cast, do you have my back? No. At that point, when you say, okay, if you ever get infected, or if any of your family get infected, we pay you. when you are telling somebody that if you get infected, you have to use your paid time off for your quarantine, are you motivating me to come back to work? Will I not just rather stay home or go and work in McDonald's and earn $16 than come and, no, seriously, knowing that my family are protected, than coming here to come and earn $150 per hour? And I know that if I drop dead or if anything happens, then my family are in trouble. We are fine. Most facilities now are making sure that we have access to employee assistance program, because believe me, the post-traumatic syndrome, from the number of deaths seen, from when you see people going through this process, serious, there are times I'll be sleeping, I wake up from my sleep with fear.
Please, I want us to stop here because I actually want to invite you again if you will accept my invitation. I want us to talk about this post-traumatic syndrome on healthcare professionals with the
Oh
number of
God.
death rates. Because I saw some videos, I saw some articles. It is very, very terrible. And the reason why I want to invite you is because you happen to be victim too, so you can, when you tell us, people will understand that yes, somebody is saying it, this is reality, she was a victim and she's an healthcare professional. So please, I want us to leave it there because
Okay, we'll peg it there.
yes, it's an emotional
It
discussion.
is.
Yes,
It
it's quite
definitely is.
emotional. Yes, yes,
Well,
it's
I'm
quite
happy
emotional.
that they're offering us vaccination as the frontline workers. But the question still remains, you're offering me vaccination. What happened to my husband and my children? They are not even on category A or B or C. If my husband is not working, he's not an essential worker, he might not get that vaccine until they feel it's available. I understand. But the fact remains, if I'm immune and my people are not immune, I don't see it like is effective, because they go
Effective.
out. What if they get infected with another strain? Fine, you have vaccinated me, and I get infected with another strain because my people are not protected. So I just feel they have to leave it at they have to realize that this is something we have to do right now. They have to be practical. They have to walk in our shoes to understand what we are going through. They have to see the way we are saying it.
Thank you. Now, before we close the show, we end the show. Thank you very much, my guests, for coming up on the show. I want to just give you just few seconds to have your final words, advice to the government, to the people in general, to the healthcare managers, and to the healthcare professionals.
The truth about it, COVID-19 is real. I'm not seeing it going away anytime soon. Our carelessness, I must tell you the truth. I am in North Dakota. Except, of course, when you go to the store and it is right outside the door that you can't come in without masks. That is when people mask up. And this is not even about the state that I am. It's about things we are seeing online. People are still doing Owambe. People are still going for parties. They're like, they can't stay indoor.
I think we know that for United States.
Don't, like, serious. One of my colleagues looked at me in the face and told me nobody can enforce a mask up mandate. I understand it is uncomfortable. Believe me, if I tell you it is uncomfortable. I work 4 days in a week in the hospital, and I have to work my second job as a COVID resource nurse. So literally, I am masked up all the time, except when I'm in the house alone. So, like, I'm wearing mask all the time. It's not fun. But if I have to do this to protect my people, protect my loved ones, and protect you, come on, just do it. Just mask up. Stay home. Social distance. We can see, social media has made it so easy. You're so far away. Are we not doing this? Do we not feel connected? It is not until we see. It's not until we have to sit down in a room and now expose ourselves to something that will kill all of us that we say we are connecting. Fine, people are depressed, right? Connect, talk, meet up. There are so many apps now, house party and all of it. You people should find a way to connect. Our policymakers should please feel what we are feeling. They should. This is not a paper thing now. The paperwork cannot. It can't work. This is not theory now. This is practical. They should please know that our unity is beautiful, our differences are colorful, and together we can fight this thing. That's just the thing about it.
Thank you very much. Our unity is beautiful and our color is
Our
beautiful.
differences are
Our difference is
colorful.
full. Thank you very much for that beautiful things there. I would like to thank my guests for coming up on the show. Kafayat POPOOLA, you can hear from her directly. I mean, the interview today was quite, I mean, knowledgeable and, I mean, full of information. And we can see even as a result, COVID-19 knows and from our own personal experience as well. These are the things that happens to healthcare professionals, the frontliners. And thank you very much for coming up on the show. And I hope when next time I invite you again, you will still answer our call.
Sure, we'll do that. Thank you so
Thank
much for having me.
Thank you very much. And to my viewers from wherever you are watching, thank you for joining me again. And if for those of you that you are not live now, don't worry, you still have access to the video on the YouTube, I mean, page, and even on the Facebook as well. And I would like to thank you very much for following up. And thank you for being part of the show to everyone. Bye bye.
Thank you. All right.